are two USMLE-style questions, integrating the concept of decreased T cells and associated infections such as CMV, EBV, JC virus, VZV, and chronic viral infections. Question 1. A 6-month-old infant presents with chronic diarrhea, failure, and oral thrush. Physical exam reveals absent tonsils and lymphadenopathy. Laboratory studies show lymphopenia, especially low CD3 plus T cells. He recently developed a vesicular rash along a dermatome. Which of the following is the most likely diagnosis? A. Bruton's agammaglobulinemia. B. DeGeorge syndrome. C. Severe combined immunodeficiency. D. Wiskott-Aldrich syndrome. E. Hyper-IgM syndrome. Correct answer. C. Severe combined immunodeficiency. Explanation. CID presents early with T cells and often B cell function too. The vesicular rash suggests VZV reactivation, which is more severe in T cell immunodeficiency. Chronic viral infections, GI, respiratory, failure to thrive, and lymphopenia are key clues. Why not the others? A. Bruton's, B cells, not T cells, more bacterial infections. B. DiGeorge can cause T cells, but often with cardiac abnormalities and hypocalcemia. D. Wiskott-Aldrich, eczema, thrombocytopenia, and combined immunodeficiency, but not severe T cell depletion. E. Hyper-IgM, defective class switching, usually more bacterial infections. Question 2. A 35-year-old HIV-positive man with a CD4 plus T cell count of 45 milliliter presents with progressive visual loss and weakness. MRI reveals non-enhancing white matter lesions in the parietal lobe. Which of the following viruses is most likely responsible for his symptoms? A. Cytomegalovirus. B. Epstein-Barr virus. C. JC virus. D. Varicella-Zoster virus. E. HSV1. Correct answer C. JC virus. Explanation. This is progressive multifocal leukoencephalopathy, PML, caused by reactivation of JC virus in the setting of T cell deficiency, e.g., advanced HIV. JC virus affects oligodendrocytes demyelination. Why not the others? A. CMV can cause retinitis or encephalitis, but lesions are usually enhancing. B. EBV linked to lymphoma, CNS, not demyelination. D. VZV can cause encephalitis or shingles, not PML. E. HSV1 causes temporal lobe encephalitis, enhancing lesions with hemorrhage. Question. A 28-year-old man with advanced HIV presents with visual disturbances. Fundoscopic examination shows bilateral retinal hemorrhages and fluffy white lesions along the vascular distribution in the retina, pizza pie appearance. His CD4 plus T cell count is 35 mm². Which of the following pathogens is the most likely cause of his symptoms? A. Herpes simplex virus type 1. B. Epstein-Barr virus, EBV. C. Toxoplasma gondii. D. Cytomegalovirus, CMV. E. Varicella-Zoster virus, VZV. Nashed. Correct answer D. Cytomegalovirus. Explanation. CMV retinitis is a classic opportunistic infection in T cell immunodeficiency, especially AIDS patients with CD4 plus 50 millibecquerel. It causes painless visual loss and retinal findings like hemorrhages with white exudates, often described as a pizza pie appearance. Why not the others? A. HSV1 can cause encephalitis, rarely retinitis. B. EBV associated with lymphoma, not retinitis. C. Toxoplasma gondii causes ring-enhancing brain lesions, not retinal involvement in this pattern. E. VZV can cause shingles or acute retinal necrosis, but CMV is more likely in this CD4 range with this appearance. Question. A 21-year-old college student is brought to the emergency department due to fever, headache, and new-onset seizures. He is confused and disoriented. Lumbar puncture shows lymphocytic pleocytosis and elevated protein. Brain MRI reveals hyperintense lesions in the temporal lobes. Which of the following is the most likely causative agent? A. Cytomegalovirus, CMV. B. Epstein-Barr virus, EBV. C. Herpes simplex virus type 1, HSV1. D. JC virus. E. Varicella-Zoster virus, VZV. Correct answer C. Herpes simplex virus type 1, HSV1. Explanation. HSV1 is the most common cause of sporadic fatal encephalitis in adults. It has a predilection for the temporal lobes, leading to seizures, altered mental status, and trifocal neurologic deficits. Diagnosis is supported by CSF lymphocytosis, temporal lobe findings on MRI, and confirmed by PCR. Why not the others? ACMV typically affects immunocompromised patients and causes ventriculoencephalitis. B. EBV, more commonly associated with mononucleosis or CNS lymphoma in AIDS. D. JC virus causes PML. MRI shows non-enhancing white matter lesions. EZV can cause encephalitis, but usually presents with zoster rash or multifocal vasculopathy.